Commissioner Thompson moves to approve the agenda, Mr. Chair.
Thank
Commissioner
you.
Fry seconds.
Okay, we've got a motion and a second. Any further discussion? Hearing none, I will call only for nay votes. Any nays? Okay, thank you. We will now move into the next portion. We're going to welcome our new Oregon Health Authority Behavioral Health Director, Ebony Clark. Have the honor today of welcoming our new Behavioral Health Director, and who has most recently been involved with the Health and Human Services Director at Multnomah County. So now we have a state leadership with deep understanding of county services. Director Clark, you have been at the Oregon Health Authority for 2 weeks now. We're hoping that you may have an update on the development of the new behavioral health CFAA, but we'd also like just a few minutes of the floor for your vision of your new post and any thoughts on how AOC and counties may be assistance to you. And I'm not seeing her.
Yes, I wrote that lovely script for you. She may just be running late because I think I told her that she was on probably around 8:10 or so.
Okay.
So if we want to move on to the next thing, which is that me?
Yeah, policy budget updates.
Okay. So I would welcome anyone as I'm going through this, any of our county lobby partners, Annalise Dolph, who's here from the governor's office, welcome. If there's anything that you want to chip in on as I go through this, please feel free to do that. If anyone has any questions, stop me and ask. I'll just mention the public health budget hearing is next Tuesday in the Ways and Means sub. AOC will be submitting written testimony. The public health budget is up for public hearing on the 23rd in the Ways and Means sub. Commissioner Bethel is teed up to testify for AOC on that. March 17th, next Friday, is the first chamber deadline for posting a work session. So any bills that don't meet that will be essentially dead. Anything can be resurrected if there's enough political will, of course, but that should narrow down our workload considerably next Friday. We'll know what's likely to move and what isn't at that point. The policy hearings on priority bills that happened this week. House Bill 2506, Chair Kramer testified for AOC along with his Wasco County Sheriff in support of residential treatment and supported housing supersiding. I thought that went really well. The committee seemed really on board with the concept. House Bill 2543, I testified on behalf of AOC in support of costing out county behavioral health services every 4 years to help course correct the budgeting for the extra work that is inevitably added on to CMHP workloads every biennium with great new policy ideas. Senate Bill 319 had a hearing yesterday afternoon. Commissioner Farr testified on behalf of AOC, and Commissioner Rosenbaum also testified in support of the bill. That's the state indemnification for counties and providers for aid and assist community restoration services. It was an interesting hearing. The trial lawyers who spent all last year on our coalition group developing this idea suddenly went off the rails and showed up and testified in opposition. So we will be working on amendments and explanations to the committee to help them understand some of the frankly untoward testimony that they presented that really confused things and wasn't accurate. So some more work to do there. Next week, House Bill 2544 is up for hearing Monday afternoon. That's funding for increased statewide capacity for mental health addictions and addictions licensed residential facilities. AOC will, I will probably testify unless one of you feels strongly about that and wants to present the testimony. There's no number on that yet, so we'll see how that shapes up. The Housing and Homeless Emergency Response Omnibus Package has a work session today, both bills, the policy bill and the funding bill. So if you will turn in your packets to, what is it, co-chair for House Bill 3126, they're just 3 bills that a couple of them were fairly, oh, Director Clark has joined us. So co-chair, I'm going to hand it back to you to give your welcome to her, and then we'll go back to that agenda item.
Okay. Welcome, Director Clark. I'm pleased to have the opportunity to introduce you to our group today, and we're very glad that you're joining us. You've recently been with the Health and Human Services with Multnomah County. We're very pleased to now have state leadership with a deep understanding of our county services. We know that you've been in your chair for a couple of weeks now, and we're hoping that you may have an update on the development of the new behavioral health CFAA, but we'd also like to just give you the floor to talk about your vision for your new post and any thoughts on how AOC and our counties may be assistance to you. Welcome.
She put in the chat that she was having trouble with the audio, so we may need to give her a minute.
Technology is so great.
Every performance needs dress rehearsals.
Good morning. Can everyone hear me?
Yes, good morning and welcome. Did you, were you able to hear my introduction?
No, I wasn't. Sorry, I was not.
Okay. Director Clark, thank you for joining us this morning. We're very pleased that you have the new leadership for the behavioral health side of Oregon Health Authority, and coming from Multnomah County, you have a deep understanding of counties, and so what we would like today is a update on the behavioral health CAFA, but we'd also like to visit with you about your visions for your new post and how AOC and our counties may assist you in that endeavor. And I will give you the floor. And you're muted. You're still muted.
I'm still getting used to the state technology. So my name's Ebony Clark, and my pronouns are she, her, hers. This is literally the end of week 2. So there's already been a lot of changes and continued, I'll just say transition. I'm sure y'all all seen that James Schroeder announced that he'd be resigning from OHA. This is week 2 for me. So just to share a little bit about just who I am, I have over 25 years of experience working in the behavioral health and health arena, both on the public side as well as on the nonprofit side. I'm a licensed clinical social worker. I have oversaw a number of services specific to child, family, and youth early on in my career, specifically youth prevention, youth mental health, in addition to also just our general outpatient and residential services for both children, youth, and adults when I was on the nonprofit side at LifeWorks Northwest. I also have experience running behavioral health services for the juvenile justice system in Philadelphia for about 5 years. When my husband and I came back from Philadelphia, I came back to LifeWorks Northwest, was a director for a while, and then joined the county in 2010. So I was at Multnomah County for 12 years. And, you know, I had an array of leadership positions, from overseeing, you know, school-based mental health, early childhood, the ESA program, wraparound care coordination. And then I stepped into various leadership roles, such as the deputy director for Multnomah County Behavioral Health. And then I was promoted to the director of Multnomah County Behavioral Health. So yes, I have lots and lots of experience, you know, understanding the county side and our safety net services and the critical roles that counties play in supporting our continuum of care. And then for the last 2 years before I stepped into this role, I was the health department director for Multnomah County. So I had public health, behavioral health, our FQHCs, as well as corrections health. And so that's just a little bit about me. Born and raised in Oregon. My husband's from Roseburg. I was born in Roseburg, I should say. So, you know, this work is near and dear to my heart. As I just think about some of my initial priorities, you know, what I'm trying to do is bring some stability and some focus. You know, as you know, I said earlier, and as we all have seen, there's just been this constant churn and transition, which really impacts the effectiveness of behavioral health on the OHA side, really being able to hold our piece of the puzzle. And so my hope is to just kind of stabilize the ship while really, you know, building relationships, starting to gain perspective from various communities around their challenges and needs, understanding that there are some through lines, but the commonalities that we see, or the themes that we see play out, really are very unique in each community. And so I really want to make sure that I'm really understanding what and how the issues and challenges are impacting communities across Oregon, so that then as I, you know, work and hold my staff and team and programs accountable, and as I walk alongside you all and key partners and stakeholders to assure that we're really addressing the current needs. What I will say is that individuals are unique and complex. Not one human is literally the same. And so I'm a believer that we should not then have a system that looks exactly the same for every individual. We need to have a system that can flex and be agile enough to serve the uniqueness of individuals. You know, so some of my key areas of focus in the first 30, 60, and 90 days is to really understand, you know, where are we at with the current investments that have occurred over this current biennium, you know, and really wanting to understand, besides, did we get the money out? And besides, is there a contract? What's been the impact? And or are there some challenges that we need to be thinking about so that we can address it? So really wanted to understand kind of the current investments. And then, you know, I know that we all are seeing individuals who are highly impacted by chronic homelessness and polysubstance, whether it be meth, opiates, or alcohol. So, you know, I'm really also working to prioritize how do we really start to, you know, think about getting some immediate support and solutions when it comes to our crisis continuum of care. So that's a big piece for me, understanding too, again, that we need to be thinking about all of our work across the lifespan. And so not losing sight of children and youth, not losing sight of transition age youth or young adults, not losing sight of older adults, Another big focus is also the co-occurring piece, just because, a lot of who we serve, is impacted by both SUD as well as mental health. So want to really kind of focus on some co-occurring elements. Another big area of focus that I'll be digging into is just where we're at when it comes to our residential services, both on the mental health side and the substance use disorder side. And so just really wanted to understand initially, what is our capacity? What is the utilization? For those services that received investment, where are we at with that? How are we tracking what the forecast is around the needs specific to beds, so that we can be more accurate as we try to develop additional capacity throughout our system. I'm super passionate about making sure too that, I'm really working to understand the challenges and issues from an equity lens, so that then again, as we start to delve in to do better and to enhance, we have that equity lens. And so when I talk about equity, for me, there's 3 core elements to equity. I think of health equity, racial equity, and geographic equity. And so when I talk about equity, I'm not just talking about racial equity. I'm not just talking about health equity. Because for me, like I said, I have family in-laws in Douglas County. I have family on the Warm Springs Reservation. And so, I understand the importance of how do we think about how our system needs to be enhanced when we're thinking about some of our rural and frontier communities as well. Sorry, my dogs are wrestling in the back, so if you hear them, my apologies. And then the last thing I'll say, because I will talk forever, is, how do we, for me, I have some core values. And one of my core values is really working to ensure that we are consumer and peer informed and led at the inception of what we do, from policy to practice. And it's not just talk. And so, I believe the importance of us living out that value. And so how are we really integrating the perspective of those who are impacted and those that have lived experience? How are we really starting to thread the needle in enhancing our system from that perspective? And so, again, really wanted to make sure that, I'm taking stock and really understanding like where we're at on the OHA behavioral health side in our role. And the last thing I will say is that, accountability and transparency is another piece that's very important to me. And so accountability starts at home. And so home base is OHA behavioral health. And so again, I'll be looking to kind of just get a baseline of just where we at in the various elements of programming and, oversight that we do. And do we have an understanding of, current impact and outcomes? Because if we don't, that's going to be a problem as we try to move forward and bring forward some enhancements. And so simply put, for some of y'all that know me, and I don't know what this means, if this is a good thing or a bad thing, but sometimes I think about stuff in my sleep. And the last 2 nights ago in my sleep, I was like, how do I just simply in 2 or 3 words capture what my priorities are and what my commitments are? And so in my sleep, here's what I'm saying. And, I'll let me know what you think and if it makes sense. I'm about, and my commitments and priorities are action and accountability to get out of reactivity. So thank you for having me, and I'm happy to answer a couple questions. And again, this is literally the end of week 2 for me. So.
Thank you, Director Clark. Very informative and I think somewhat uplifting for all of us. And so I would, since you offered up a couple of questions, we have some time for you. Are there any questions for the director? Got a thumbs up from Commissioner Starrett.
Thank you. I'm having internet problems, so I hope you can hear me.
Yes,
and thank you, Chair, and welcome, Director Clark. Welcome, Director. We appreciate your taking time. I appreciate the fact that you mentioned geographic equity. I am in one of the 25 counties that were not called out, specifically in the governor's executive order for homelessness funds. We were told we could declare an emergency. We're finding out that it's not the bright, shiny thing that's been presented to us. So I'm just hoping that you can put in a good word for the counties. We do have significant homelessness, behavioral health, all of the issues that encompass your portfolio in terms of the behavioral health portion of that in our county. And we are sort of getting the short shrift because we're the rural counties. So please keep us in mind. We do have problems even though we're not in Multnomah County. Thank you again for being here.
No, and thank you for that. And, again, I just got started, but my hope is, within the first 6 months, I'll be more realistic. And rather than 3 months, first 6 months, I really want to also kind of start to get out as I can and meet with local communities just to hear, what y'all are grappling with, what your priorities are, and how I can step in to be a strong partner and hold my piece of the puzzle in this. So.
Thank you. We've got two more questions, Commissioner Thompson and then Commissioner Chang.
Thank you, Mr. Chair. Director Clark, oh my goodness, I am so inspired. That's absolutely what we need to be doing. I think we are your devoted partners in this. Consider yourself invited, because it will be our joy to share both our despair and our hope with you, and be looking for that forward-looking, effective action. Thank you so much.
Thank you for the invitation. I think a few weeks ago, I forget which interview I was doing, and maybe it might have been with the Portland Business Journal. And one of the questions was, what do I hope to do as I step into this role? And, I did a quick reframe, which for me, it's not hope, it's have to. And that's what my commitment is. And I'll say that, I'm very direct, and I expect for you all to hold me accountable. And I'm really committed to this work.
Commissioner Chang.
Good morning, Director Clark. Thank you for joining us today. Coming from a county health department, you have unique insights on the relationship between OHA and counties. I mean, I'm guessing down to the agreements and program elements level and reporting and all sorts of things like that. I would love to hear about how those insights on the relationships between the state and counties is going to show up in your work as the director now of a major program within OHA.
Yeah, thank you for the question. I'm a believer. Well, I'm not a believer, but and from my perspective, our system, our behavioral health system, is really held up by some key pillars. And so, I think about, the state as, the base pillar, because the state provides oversight to both the CCO and then the counties. And then I think about within that, there's these concentric circles specific to peers and consumers and to community. And so, and then also you bring in your community-based providers. And so for me, I think about how do we really work from a shared vision. And for me, I've learned that, I've only been successful because of the amazing people that I've had the opportunity over the course of my tenure to work with. And, work gets done through relationship and trust. And I think that, and I've seen it play out just in various situations where internally we got, a us versus them perspective. And, I think that I can, think about us versus them perspective in a lot of different kind of arenas. And so I really want to help diffuse and dissolve the us versus them. I really want to do my part in diffusing the contentiousness. I think, in my opinion, we all can always enhance and improve what we do. And you do that through, continuous quality improvement. And so consistently pointing fingers to say, well, you're failing here and you're not doing that. Okay, well, we all know that. While we're sitting there pointing fingers, we have people suffering. And so how do we get away from this us versus them? How do we start to work from a shared vision? How do we start to build relationships and trust so that people know? And I'm just going to keep it 100% real. And it's Friday, and I always say I have a Friday filter. I want to build trust so that, folks don't assume that because I'm a Black woman, the only thing I care about are people of color or Black people. I want to build trust so people know that I have the full Oregon purview and commitment, in my heart and in the work that I move forward. So I want to be able to build this trust and relationship so folks know that while I might not look like you and while I might not come from your community, I'm thinking about you. I'm going to prioritize the needs in the community. And again, it's a collective process. I always say it's not me, it's we. Because the last thing I'll say is that I'm a believer that individuals and communities hold key answers to solutions, for health and wellness. And so my job is to, again, hold my peace and walk alongside in partnership. And so that's what I'm going to do, understanding that I need to have, some recommendations and some thoughts, which I will. But again, I think it's disrespectful for me to step in and go down the Coos Bay to say, hey, this is what you all need to do. No, I'm here to be a partner. Tell me what you need from me. So that I can work on, delivering what my commitment is.
Thank you, Director Nickel.
Great. Thank you. Ebony, I just want to say a warm welcome from the counties. We are so pleased that you are on board. And I have worked for 40 years in mental health and couldn't be more joyous that you are on board and looking forward to working with you, not only from the state perspective, but from that county and local perspective. You will have big fans and big partners here at the county. Please reach out anytime. Anything you need from us, we'll always be willing to be at the table with you.
Thank you.
Thank you. Thank you so much. And I just want to say this is a great way to end, another interesting second week. So thank you for having me.
Yes, we certainly do appreciate it. And Gina hit it right on the head. So we'll let you go back to your busy day, and we look forward to visiting with you in the future. Okay, Jessica, we'll go back to our policy budget updates. Do you want to maybe summarize what you touched on earlier, and then we can keep moving on?
Oh, sure. So behavioral health and public health budget hearings are coming up next week and the week after that. AOC will either be testifying in person or in writing. The first chamber deadline is the end of next week, so we'll have a better idea of which bills will be moving forward after that. One thing that I didn't mention when I started earlier, Representative Nose, as I think I told you last month, has a weekly work group that is focusing on the treatment side of Measure 110 and what stakeholders think is needed to make that process for granting going forward smoother, more transparent, and frankly better in how the money is rolled out. AOC and the counties who are participating in that work group, our priorities for that are to advocate for either a county or a CMHP rep on the Oversight and Accountability Council. That's a really critical voice that's missing right now. A lot of expertise there that the council could benefit from that they don't have right now. And then we're strongly advocating that CBOs and CMHPs have an MOU in every region where they're operating, every county where they're operating, to ensure that nobody on the ground is falling through the cracks between the really great services the CBOs are providing, the harm reduction and helping people prepare to be ready for treatment, and then getting them into the treatment system, the traditional treatment system that we provide. So those meetings have been really good so far. I think there'll probably be 2 or 3 more before Rep. Nose has a handle on what he wants to go into his bill, but I'll keep you updated on the particulars of that as they get plugged in. There are 3 bills that I just sort of wanted to bring to your attention. I don't know that we need to take a position on them ever, or right now. I didn't put them on the action calendar. Sorry, I have too many things open in my Adobe. Where are